If you wake up every morning with something sitting at the back of your throat that you need to clear before you can speak comfortably, or if you feel like there is something in your chest that will not fully shift no matter how many times you cough, or if your voice sounds different in the first hour of the day than it does by mid-morning, this video is going to explain what is actually happening and what you can do about it. Mucus and phlegm are not the same thing, and the distinction matters for understanding both the cause and the solution. Mucus is the clear or slightly white substance produced continuously throughout your respiratory system, from your nose to your sinuses to your throat and down into your airways. It is not a symptom of anything when it is present in normal quantities. It is a normal, functional part of how your body works, trapping dust particles, bacteria, viruses, and other inhaled material, and either neutralizing them or moving them out of the airway through the natural sweeping action of tiny hair-like structures in your airway lining, called cilia. Your body produces approximately 1 to 1.5 liters of mucus every day, even when you are in perfect health, and most of it is swallowed without you ever noticing it. Phlegm is the term specifically for the thicker, often colored mucus that is produced in your lower respiratory system, in the bronchial tubes and the lungs, when something is triggering an inflammatory response there. When you have phlegm, you are aware of it in a way you are not aware of normal mucus, because its quantity, its consistency, and often its color have changed in response to something your body is reacting to. Understanding which one you are dealing with changes what you do about it. The persistent throat clearing in the morning is almost always excessive mucus pooling in the back of the throat and upper airway during sleep, which is a drainage issue. The thick, productive cough with colored phlegm coming up from the chest is a lower respiratory issue. These are different problems with overlapping but not identical solutions, and I am going to address both. Let me start with why these things happen. Because removing the cause is always more effective than managing the symptom, and the causes are more specific and more addressable than most people realize. The most common cause of chronic mucus buildup in the throat and upper airways is postnasal drip. Your sinuses are continuously producing mucus that normally drains downward through the back of your nasal passages into your throat where it is swallowed. When this drainage is excessive, when the sinuses are producing more mucus than usual, or when the drainage pathway is partially obstructed, that excess mucus pools at the back of the throat and upper airway. You feel it as a constant need to clear your throat, a sensation of something dripping down the back of your throat, or a slightly mucus-coated feeling that persists through the day. Postnasal drip is triggered by several distinct mechanisms, and identifying which one applies to you is the key to addressing it, rather than simply managing the symptom indefinitely. Allergic rhinitis is the most common cause. If your mucus symptoms are seasonal, appearing or worsening at specific times of year that correspond to pollen seasons, or if they are perennial but associated with specific exposures like pet dander, dust, or mold, you are almost certainly dealing with allergic postnasal drip. The mucus in allergic rhinitis is typically thin and watery, clear or pale, and is produced in response to the inflammatory cascade triggered by allergen exposure. The treatment here is allergen reduction first, antihistamines second, and if those are insufficient, a conversation with an allergist about immunotherapy options. Non-allergic rhinitis is equally common but less understood by most people, because it produces the same mucus symptoms as allergic rhinitis without any allergic trigger. Non-allergic rhinitis is triggered by irritants, changes in temperature or humidity, strong smells, certain foods, alcohol, and in some people by hormonal changes. The most common dietary trigger for non-allergic rhinitis is spicy food, which causes a reflex mucus production through a mechanism involving a receptor called TRPV1 in the nasal lining, the same receptor that responds to capsaicin in hot peppers. If you notice your mucus symptoms worsen after meals, particularly spicy meals, or if blowing your nose during or after eating is a regular experience, non-allergic rhinitis triggered by food is likely involved. Dairy consumption is one of the most persistently debated causes of mucus thickening, and I want to give you the honest picture on this because the research does not fully support the common belief that dairy causes excess mucus production. What dairy does in some people is increase the thickness and viscosity of the mucus that is already present, making it feel more pronounced and harder to clear, without necessarily increasing the total amount produced. If your mucus symptoms feel noticeably better when you reduce or eliminate dairy for a period of several weeks, dairy is likely a contributing factor for you specifically. If you try that elimination and notice no difference, dairy is probably not relevant to your situation. Gastroesophageal reflux disease, commonly called GERD or acid reflux, is one of the most underappreciated causes of chronic throat mucus and throat clearing. When stomach acid or even non-acidic stomach contents reflux upward through the esophagus and reach the level of the larynx, the vocal cords, and the back of the throat, they trigger a protective mucus response in those tissues. This is sometimes called laryngopharyngeal reflux or LPR, and it often presents without the typical heartburn symptoms people associate with acid reflux, meaning many people with reflux-related mucus symptoms do not know that reflux is the cause. The pattern that suggests LPR as a cause is mucus symptoms that are worst in the morning after lying flat all night, which allows reflux to travel further up the esophagus, along with possible hoarseness, chronic throat clearing, and a sensation of a lump in the throat. Dehydration is consistently underestimated as a factor in both mucus quantity and quality. When you are not adequately hydrated, the mucus your body produces becomes thicker and stickier rather than the thinner, more fluid consistency that is easier to clear and that moves more efficiently through the ciliary sweep mechanism. This is why staying well hydrated is one of the most universally applicable recommendations for mucus management. It is not a complicated mechanism. Thin mucus moves and clears. Thick mucus sits and accumulates. Water thins mucus. It is that simple, and it is that effective. Dry air, particularly the heated, low-humidity indoor air that most homes have during winter months, has the same thickening effect on mucus as dehydration. The mucous membranes lining the airway are designed to function in air with humidity in a comfortable range, typically between 40 and 60% relative humidity. When ambient humidity drops below 30%, which is common in heated indoor spaces during winter, those membranes produce thicker, more protective mucus in response to the drying environment, and the clearance mechanism becomes less effective. A room humidifier in the bedroom, running during sleep when you spend 8 hours in that environment, is one of the most effective and most underutilized interventions for people with chronic morning mucus symptoms. Smoking and vaping are among the most significant causes of both excessive mucus production and impaired mucus clearance, and I include them here not as a moral statement but as a physiological one, because understanding the specific mechanism helps you understand why the effects persist for weeks or months after cessation. Tobacco smoke contains thousands of chemical compounds, many of which directly paralyze and eventually destroy the cilia that line the airway and perform the continuous sweeping motion that clears mucus upward and out of the respiratory system. When cilia function is impaired, mucus that would normally be cleared efficiently accumulates in the airway. The body responds to this accumulation with a cough reflex, attempting to clear through a mechanism it was never designed to rely on as the primary clearance method. This is the origin of the persistent productive cough in smokers, and the reason why people who quit smoking often experience a temporary worsening of their cough and mucus production in the weeks immediately after cessation. The cilia are beginning to recover function, and are now clearing the accumulated mucus backlog that built up during the period when they were impaired. This temporary worsening is a sign of recovery, not a sign that cessation is making things worse. Environmental irritants beyond tobacco smoke, including air pollution, wood smoke, chemical fumes in certain workplaces, and fine particulate matter in general, trigger the same protective mucus response through a similar mechanism of airway irritation. If you live in an area with chronic air quality issues or work in an environment with significant chemical or particulate exposure, these factors need to be part of your assessment of why mucus symptoms are persistent. Respiratory infections are the most acutely common cause of both excessive mucus and phlegm. During a viral upper respiratory infection, the inflammatory response to the virus causes a significant increase in mucus production, and the mucus changes in character from its normal thin, clear state to the thicker, cloudier, or colored consistency that most people associate with being sick. The color change is informative. Clear or white mucus during an infection is still primarily a viral response. Yellow or green phlegm indicates the presence of white blood cells and their breakdown products in the mucus, which can occur in both viral and bacterial infections, and is not a reliable indicator of which type of infection is present, contrary to what was believed and taught for many years. The presence of colored phlegm does not by itself indicate a bacterial infection requiring antibiotics. What indicates a bacterial infection requiring medical attention is the combination of colored phlegm with fever, significant facial pain or pressure over the sinuses, symptoms that worsen after initially improving, or symptoms that are unusually severe or prolonged. Now let me walk you through the specific interventions that address these causes, starting with the most universally applicable and moving to the more targeted. Steam inhalation is one of the oldest and most well-supported interventions for mucus and phlegm clearance. Breathing steam hydrates the mucous membranes directly, temporarily reduces the viscosity of secretions, and supports the ciliary clearance mechanism by providing the humidity in which it functions best. To do this correctly, boil water and pour it into a bowl. Drape a towel over your head to create a tent that captures the steam, and breathe slowly through your nose for 5 to 10 minutes. The temperature of the steam should be comfortable, meaning you should be able to maintain this without pain or excessive discomfort. Adding a few drops of eucalyptus oil to the water adds the benefit of 1,8-cineol, the primary active compound in eucalyptus, which has been shown in clinical studies to have mucolytic properties, meaning it directly reduces the viscosity of mucus and makes it easier to clear, as well as mild anti-inflammatory effects on the airway lining. Do this once or twice daily during periods of active mucus symptoms, and once every few days, as maintenance during conditions that predispose to mucus buildup, such as winter heating season. Saline nasal rinsing is supported by more clinical evidence than almost any other intervention for upper airway mucus management, and specifically for postnasal drip from any cause. A saline rinse, using either a neti pot or a squeeze bottle nasal rinse device, with a prepared saline solution, physically irrigates the nasal passages and sinus drainage pathways, removing accumulated mucus, clearing allergens and irritant particles from the mucosal surface, and restoring normal ciliary function by providing the appropriate saline environment those tissues require to function optimally. The saline solution should be isotonic, meaning it matches the salt concentration of your body's own fluids, which is approximately 9 grams of non-iodized salt per liter of water, or the equivalent of a quarter teaspoon per 8 ounces. Using distilled or previously boiled water is important for nasal rinsing to eliminate the small but real risk of introducing waterborne organisms directly into the sinus passages. Rinse once daily for maintenance and twice daily during active symptoms. Most people who try this consistently for 2 weeks report a significant reduction in the constant throat-clearing need that was driving them to seek solutions. Hydration, as I mentioned earlier, is not a complicated intervention, but it is one that most people with chronic mucus symptoms are not doing adequately. The general recommendation of 8 glasses of water per day is a reasonable starting point, but the more relevant indicator is the color of your urine, which should be pale yellow throughout the day. Dark yellow urine consistently indicates chronic mild dehydration. Hot beverages specifically, beyond just their contribution to total fluid intake, have an additional mechanical benefit for throat and airway mucus. The steam from a hot cup of tea or broth provides localized humidity to the upper airway as you drink it, and the warmth itself temporarily soothes irritated tissue. Ginger tea and peppermint tea specifically have evidence supporting their use for airway symptoms. Ginger contains gingerols and shogals that have documented anti-inflammatory effects on airway tissue. Peppermint contains menthol, which activates cold receptors in the airway lining, creating the sensation of easier breathing and triggering a mild increase in mucus clearance rate. Honey has been used for respiratory symptoms for thousands of years and has accumulated a reasonable evidence base in modern research. Raw honey contains hydrogen peroxide-generating enzymes, phenolic compounds with antioxidant and anti-inflammatory properties, and antimicrobial peptides that have genuine activity against many of the organisms that cause respiratory infections. A tablespoon of raw honey in warm water or tea, taken before bed specifically, has been shown in clinical trials to reduce nighttime cough frequency and to improve sleep quality during respiratory illness, with effects comparable to or exceeding those of common over-the-counter cough suppressants. This applies to adults and children over 1 year of age. Honey should not be given to infants under 12 months, due to the risk of infant botulism. For chest phlegm specifically, the intervention that most directly supports clearance from the lower airways is a technique called controlled coughing, which differs from the uncontrolled, forceful coughing that most people do reflexively. Sit upright in a chair. Breathe in slowly and deeply through your nose, filling the lungs fully. Hold that breath for 2 to 3 seconds. Then cough twice in succession. First, a short, sharp cough from the upper chest to move secretions upward, and then a second, stronger cough to expel what has been moved up. Breathe slowly and normally for a minute before repeating. This technique, done 3 to 4 times in sequence, is significantly more effective at actually mobilizing and clearing lower airway secretions than uncontrolled coughing, which often increases airway irritation without effectively clearing the secretions. Pursed lip breathing, done in conjunction with the steam inhalation and the controlled coughing technique, helps to slow the breathing rate, reduce air trapping in the small airways, and create a slight positive pressure during exhalation that helps to move secretions upward more effectively. To do pursed lip breathing, breathe in slowly through the nose for 2 counts, then breathe out slowly through pursed lips, as if you are about to whistle, for 4 counts. The exhalation should take twice as long as the inhalation. Repeat for 5 to 10 breaths as a warm-up before the controlled coughing sequence. Elevation during sleep addresses the contribution of nocturnal pooling to morning mucus symptoms. When you sleep flat, mucus that would drain by gravity during the day pools in the back of the throat and upper airway. And in people with any degree of reflux, the proximity of the esophagus to the airway means refluxed material can reach the larynx and upper airway during sleep hours. Elevating the head of the bed by 4 to 6 inches, either with a wedge pillow or by placing blocks under the head-side legs of the bed frame, allows gravity-assisted drainage during sleep and reduces both reflux-related airway exposure and the mucus pooling that produces those difficult morning clearing sessions. Stacking extra pillows is less effective because it bends the body at the waist rather than providing a true positional elevation. Avoiding known triggers is a self-evident but imprecisely practiced recommendation. I want to be specific about it. If allergies are contributing, the most impactful single change is encasing your mattress and pillow in allergen-proof covers, which reduces overnight dust mite exposure to near zero regardless of how frequently you wash your bedding. Dust mites are the most common indoor allergen, and the mattress and pillow are their primary habitat. This is a more impactful intervention than air purifiers or frequent bedding washing alone, because it eliminates the source rather than attempting to clean the already contaminated air. If dairy appears to be thickening your secretions based on your own observation, a 4-week strict elimination, not a reduction, is the only way to assess this accurately, because partial elimination produces ambiguous results. If reflux is contributing, the standard guidance of avoiding eating within 3 hours of lying down, avoiding alcohol and caffeine in the evening, and avoiding high-fat meals that delay stomach emptying addresses the primary triggers for nocturnal reflux. When to see a doctor about mucus and phlegm symptoms is a question I want to address directly, because not all of these symptoms are benign, and waiting too long to seek evaluation for certain patterns is a genuine risk. Seek medical evaluation promptly if you cough up blood, even small amounts. If you develop a fever above 101 degrees Fahrenheit alongside chest mucus symptoms, if your breathing is difficult or you feel short of breath at rest or with minimal exertion, if you have chest pain alongside respiratory symptoms, if mucus symptoms appear alongside significant unintentional weight loss, night sweats, or persistent fatigue, if symptoms are severe, worsening progressively, or have been present for more than 3 weeks without improvement, and if you are a smoker with a new or changed cough, which always warrants prompt evaluation. Persistent mucus symptoms that have been present for more than 6 to 8 weeks, despite the interventions I have described, warrant evaluation by a healthcare provider to assess for underlying conditions, including chronic sinusitis, asthma with mucus hypersecretion, non-infectious bronchitis, or, in smokers specifically, chronic obstructive pulmonary disease. These conditions are managed differently from the common causes I have described, and require diagnosis through physical examination and potentially imaging or pulmonary function testing that cannot be substituted by home management alone. The interventions I have described today: steam inhalation with eucalyptus, saline nasal rinsing done correctly with isotonic solution and safe water, adequate hydration throughout the day, elevation during sleep, hot ginger and peppermint teas, the controlled coughing technique, and the identification and reduction of your specific triggers constitute a complete, evidence-supported approach to managing the most common causes of chronic mucus and phlegm symptoms. They work best applied together rather than singly, because the causes of these symptoms are almost always multifactorial, and each intervention addresses a different contributing mechanism. Tell me in the comments which of these symptoms you are dealing with, whether it is the persistent morning throat clearing, the chest phlegm that will not shift, or the constant sensation of postnasal drip throughout the day. And tell me how long you have had it and what you have already tried, because understanding what has and has not worked for you helps me give more specific guidance in the replies. I read every single comment. Next time, I am going to cover the most common reason people cannot breathe easily through their nose at night, what is actually happening in the nasal airway during sleep, and the specific interventions that address each cause, because nasal obstruction during sleep is one of the most impactful and most undertreated factors in morning fatigue, mucus symptoms, and overall respiratory health. I will see you then.